Toronto's top doctor is stressing decriminalization is not legalization, and the goal is to treat addiction as a health issue, not a criminal one, as she clarifies the city's stance about public drug use.
It is not what is contemplated in our decriminalization application, and it's not acceptable. It doesn't make that legal. It doesn't make selling or trafficking of drugs legal.
In a submission to Health Canada last year, Dr. Eileen De Villa, the city's manager and police chief, proposed a plan that would decriminalize all controlled drugs and substances for personal use for all people in Toronto, including youth. The request is even more sweeping than what's being tested in BC, where the government, only 1 year into a 3-year pilot project, has asked Ottawa to once again allow police to take action against people who use drugs in public. Possession of small quantities of hard drugs will still be decriminalized, but in private spaces. In a letter to the Prime Minister, the federal Conservative leader is urging Trudeau to reject Toronto's application.
I will fight this tooth and nail.
And the Premier also weighed in this week.
Give them treatment, support them. That's what we need, not say, here's some more drugs to take. Sometimes I wonder where people's brains are. I really do. It's unbelievable.
Toronto is requesting decriminalization apply to all areas of the city, except childcare facilities, elementary and high schools, and airports.
How do you prevent public use?
Well, making sure that we have safe spaces to use, proper supervised consumption services.
And I think for me, that's the key part.
Professor Akwasia Wusu-Bempa says curbing open drug use is a difficult thing to do, especially given the housing crisis, but adds there are lessons to be learned from prohibition.
There were, as there is now with our drug supply, a tainted drug supply. Many people experienced alcohol poisoning and died. We now have safe consumption sites for alcohol. Those are bars. Having safe and supervised sites for individuals to use drugs is the most appropriate way forward, and that is exactly what Toronto should be looking at.
Health Canada says Toronto's application for an exemption to the federal drug law is still under review. For City News, I'm Caryn Ceolin.